You need to hear this if you're struggling with depression. Meet Professor Kennedy Edem-Kukuya, a leading expert in the field of mental health. His groundbreaking research is helping millions understand and combat depression. Depression is more than just feeling sad, it's a serious mental illness that affects millions worldwide. It impacts thoughts, feelings, and behaviors. People with depression may experience deep sadness, loss of interest, and fatigue. These symptoms can last for weeks, months, or even years. Depression has a significant impact on daily life. It can affect work, relationships, and overall well-being. The World Health Organization recognizes depression as a leading cause of disability. It affects people of all ages and backgrounds. While the exact causes of depression are complex, research points to several factors. Genetics, brain chemistry, and life experiences all play a role. Imbalances in brain chemicals called neurotransmitters are believed to be involved. These chemicals like serotonin, norepinephrine, and dopamine are crucial for mood regulation. Imagine a bustling city where buildings communicate with each other. Normally, after neurotransmitters like serotonin are released into the synapse, they are reabsorbed by the releasing neuron in a process called reuptake. Antidepressant medications work by inhibiting this reuptake process. By blocking the reabsorption, these drugs increase the levels of neurotransmitters available in the synapse. This helps improve communication between neurons and can alleviate symptoms of depression. Along with therapy, these treatments can significantly enhance quality of life. Understanding the nature of depression and the mechanisms of these treatments is essential for both patients and healthcare providers. Section 2. The brain's chemical messengers and depression. The human brain is a complex network of billions of nerve cells called neurons. These neurons communicate with each other using chemical messengers called neurotransmitters. Think of them as tiny boats carrying messages across rivers in the brain. When it comes to mood, neurotransmitters like serotonin, norepinephrine, and dopamine are key players. Serotonin is often called the feel-good chemical, promoting feelings of well-being and happiness. Norepinephrine is involved in alertness and energy levels. Dopamine is linked to pleasure and reward. In depression, these delicate chemical balances are disrupted. Imagine a shortage of boats or blockages in the rivers. Messages don't get through effectively, leading to the characteristic symptoms of depression. Levels of serotonin, norepinephrine, or dopamine may be too low, or their activity may be impaired. This understanding of neurotransmitters is crucial for developing effective treatments. Antidepressants work by targeting these chemical messengers, aiming to restore balance and improve communication within the brain. Section 3. Antidepressants, different types, different actions. Antidepressants are medications designed to treat depression by influencing neurotransmitter activity in the brain. There are several different classes of antidepressants, each with a unique mechanism of action. Selective serotonin reuptake inhibitors, SSRIs, are the most commonly prescribed class. They work by increasing serotonin levels in the brain. Examples of SSRIs include fluoxetine, which you might know as Prozac, sertraline, also known as Zoloft, and escitalopram, often referred to as Lexapro. Serotonin norepinephrine reuptake inhibitors, SNRIs, target both serotonin and norepinephrine. They increase levels of these neurotransmitters, aiming to improve mood and energy. Venlafaxine, or Effexor, and duloxetine, known as Cymbalta, are examples of SNRIs. Tricyclic antidepressants, TCAs, are an older class of antidepressants. They have a broader impact on neurotransmitters, affecting serotonin and norepinephrine levels. Examples include amitriptyline, known as Elavil, and imipramine, referred to as tofranil. Monoamine oxidase inhibitors, MAOIs, are another class of antidepressants. They block the action of an enzyme that breaks down neurotransmitters, leading to increased levels. MAOIs, like phenelzine, known as Nardil, and tranylcypromine, often called Parnate, require a special diet due to potential interactions with certain foods. Section 4. How antidepressants work. A closer look. Imagine a synapse, the tiny gap between two neurons, as a bustling harbor. Neurotransmitters are like ships carrying messages across this harbor. Antidepressants work by influencing the activity in this harbor, ensuring messages are delivered effectively. SSRIs, for example, act like traffic controllers in the harbor. They block the reuptake of serotonin, preventing it from being taken back up by the sending neuron. This action increases the concentration of serotonin in the synapse, making it more likely to bind to receptors on the receiving neuron. SNRIs have a similar mechanism but target both serotonin and norepinephrine. They act like harbor masters, ensuring a steady flow of both types of ships. This dual action can be particularly helpful for individuals with depression who also experience low energy and fatigue. TCAs work by blocking the reuptake of both serotonin and norepinephrine, but they also affect other neurotransmitters. Think of them as general contractors, making various improvements to the harbor infrastructure. However, this broader action can also lead to more side effects. MAOIs, on the other hand, act like shipbuilders. They inhibit the enzyme monoamine oxidase, which breaks down neurotransmitters. This inhibition leads to a greater number of ships available to carry messages, increasing neurotransmitter levels in the brain. Section 5. Understanding for effective treatment. Understanding the different classes of antidepressants and their mechanisms of action is crucial for effective treatment of depression. Each class influences neurotransmitter activity in a unique way, leading to a range of potential benefits and side effects. SSRIs are often the first-line treatment due to their favorable safety profile and effectiveness for many individuals. SNRIs may be a better option for those with low energy or chronic pain. TCAs, while effective, are generally reserved for cases where other antidepressants haven't worked due to their potential for side effects. MAOIs, with their dietary restrictions and potential interactions, are typically used when other treatments have failed. It's essential to remember that antidepressants are not a one-size-fits-all solution. Finding the right medication and dosage often requires careful consideration and collaboration between the patient and healthcare provider. Factors such as individual symptoms, medical history, and potential drug interactions all play a role in treatment decisions. Moreover, antidepressants are most effective when combined with psychotherapy. Psychotherapy provides essential tools and strategies for managing the emotional and behavioral aspects of depression. This combined approach addresses both the biological and psychological factors contributing to the illness.